Hello, everyone.
Hi guys, welcome to episode 8.
Eight of the
8
Expectancy
See,
mini
series.
series. Good to have you back with us. All
Good
right.
to be back.
So this week, this episode, we want to talk a little bit about the differences in the experience between having gone through the public side of the healthcare system for antenatal care on the first pregnancy, and this time around, the private side of things for antenatal care. Uh, Big differences.
Night and day.
Yeah, like night and day. The importance of having health insurance to deal with the expenses associated with antenatal care, good antenatal care, and not just having health insurance, but having the right health insurance. So we'll talk a little bit about that in this episode. But before we go further, we'll take a quick break for a word from our sponsor, Avid Beauty Loft.
Take it away.
Welcome to Avid Beauty Loft, owned by Teddy Jones and Latoya Berry Jones. Get your Christmas gifts.
Welcome back, guys. So, we are going to be talking about public care versus private care, what to put in your hospital bags, when to start packing your hospital bag. It's going to be interesting the next couple of weeks from now, right, babe?
Oh yeah, it's gonna get things are gonna happen very quickly, and it's gonna get even more interesting as we get closer to the big day. Of course, remember the gender reveal is set for December 5. That's just a couple of weeks away. Yeah.
And we'll be streaming. We'll be streaming. We'll be
Yeah,
live?
yeah. We hope to be able to
Yeah.
do a live stream and that will be the episode
Episode
for
9.
for that particular.
Right,
No,
so-
not 9. We're gonna have
Oh.
9, 10, probably 11, 12. What?
Demos.
Yeah, thereabouts. December
I
5.
think it's next week.
Save the day. You're too excited, I
I
guess.
know. Can't wait.
Right. Okay, so with Zach and Asia, our son, 7 years ago, we went through the public side of for the antenatal care at University Hospital of the West Indies. And because we spoke about the pregnancy-induced hypertension issue early in the series, one of the earlier episodes, and so from very early, we had to start very early. At week 5, when we visited our family doctor, who confirmed the pregnancy, he detected the higher readings, and so he said to us, "Don't delay, get up to UE and get registered right away." So we started clinic very early, and there's this system that they use depending on the risk factors that they call firms. So there is the low risk, mid risk, and high risk firm, and then the firm that you're assigned depends on how often you do clinics. So I think we were on what was midterm, right? Medium firm, mid firm. Yeah.
Medium risk.
Medium risk. So essentially, that meant that we had clinic every other week, and that it in itself can be quite a challenge. Additional
Quite
stress,
frustrating.
on top of all the stress with the pregnancy itself. I was working full time at the time. Thankfully, she wasn't. Latoya wasn't, but it became was quite a bit of a hassle to have to be scheduling that every 2 weeks, and so of course, being on the public side of things, the costs were for visit. There were no costs for the prenatal visits. There were costs, of course, when we had to do like the various ultrasounds at the
They
different
were
stages.
costs. We had at registration. We
Well,
had
yeah,
to,
yeah, yeah. There was a
we had to
registration
submit
cost.
insurance and pay
Right.
for it. So what happens is that when you book into a hospital from early or when at whatever stage, you register, you swipe your insurance card, and then you pay the difference to what the card doesn't cover. But you do pay, but not what those hefty other hospitals would cost you. So it was good. So you pay for the entire duration of the pregnancy, right, up
For
until
the prenatal visits.
delivery, and then at the end of that, the hospital gives you the final bill and you pay it in installments. So it makes it easier for you.
Right. But speaking of insurance, some of the so of course, if you don't have health insurance, even if you're going through the public side, I suppose maybe it's a different system at the clinics. A lot of people use the clinics, or the public clinics, health clinics. Not quite sure what it's like if you register at Victoria Jubilee and all. But if you don't have health insurance, then there are costs, and those costs have to be taken care of. But then having health insurance, there are some of the health insurance providers that they have all these fine prints, and of course sometimes it's not even in print. You're not even told until you need to know. Yeah, it's kind of like a need to. They treat it like a need to know basis. I'm not gonna call any names, but that was when we discovered that a number of the things that we needed to take care of during the antenatal period were not going to be covered upfront. You had to pay cash out of pocket and then claim afterwards. And when you claimed, you weren't getting the 80% that you're normally accustomed to. So it's very important that you discuss those matters with your health insurance provider very early. Find out all the clauses and all the different fine prints associated with covering pregnancies.
And how much exactly
Right,
it is
exactly
and
how
what
much.
it's covering.
Yeah, what is covered, how much, and the different terms and conditions. Because otherwise, you may find yourself having quite some shockers, expensive shockers at that. Yeah, so that was on the public side of things with Expectancy. This time around, we opted to go the private route, particularly because of the challenges that we had the last time around, the PIH and the shoulder dystocia, as we spoke about in the first two episodes. We wanted to make sure that we were seeing highly recommended doctors, experienced doctors, and we are so glad that we did so far,
blessed.
because it's been a tremendous blessing.
Yeah.
Dr. Campbell, really good OBGYN, and the issues that we had to discuss based on the experience with the first delivery and the first pregnancy and up into the delivery, it was important that we had very personalized care, and of course again additional costs. It's private, so the costs are going to be higher, but thankfully in God's goodness and in God's grace, we were able to get a second health card just in time.
In the nick of time.
In the nick of time, you know.
In the
God,
nick of
God is
time.
an on-time God, and we are so grateful for that.
Yes, He
So
is.
most of the costs so far have been very minimal. In some cases, we paid zero by the time both cards are swiped, and thank God for that. So it is a very important factor. When I think about the many things that can go wrong and the importance of doctors walking with you right through this journey, it reinforces my belief that pregnancy really should be properly planned as much as possible, because and again, for the men who just cop out when the woman gets pregnant and leaves her dealing with all the changes physically, emotionally, and then the expenses. I really don't understand how the brothers are sleeping comfortably doing that kind of a thing, because it can be quite expensive. And so you want to plan properly, and you want to put measures in place so that all those things are covered. And you choose wisely. Do your research on the different doctors that are available. There's, of course, and no disrespect, but there are doctors and then there are doctors. So you want to do that. Make sure you do your research and choose your antenatal care providers very carefully.
And we have been very blessed to have people in our space who knows of doctors who are really good, so it's very good to have that support system. It's really
Right.
good to have networking. It's really
Yeah,
good
your network.
to have people who can refer you. It's really amazing, and doors just open up and you get results. So it's really good. Thanks to all our supporters, all the people in our space. We really love and appreciate you. Really
so you
love.
see, the tangible support has started
Really
to
love
come in.
and appreciate
you've
you
got
all.
thanks,
Thanks for family,
blessings.
who's always praying. So we really appreciate it. So my husband has taken over this episode so very well. I mean, he's an expert.
Teamwork.
Maybe you're an expert. Oh my gosh,
It's
I love it.
It's a learning experience, and it's a tremendous journey. I take it very seriously. Just a couple of days ago, I was on Love FM on the mailbox program, and the topic was husbands or baby father. Just looking at the whole phenomenon of the baby father thing, and what are the differences between having a husband versus having a baby father. I'm not going to get into that, but a lot of fathering issues are in the news right now. There was this big thing in Parliament about paternity testing, and then the whole matter of the statistics around the prevalence of jackets being given to men. So that's very topical right now. I take this responsibility very, very seriously, and I want to encourage the brothers to do likewise. It's an awesome privilege. It's an honor. It's a privilege. As I said in that interview on Love FM, it's a privilege and it's an honor. So I'm enjoying it thoroughly. So we're nearing the end of trimester 2.
Couple
more weeks to go, and then so it will soon be time to pack the go bag.
Yes.
And the last visit the doctor said that the weight is just about in kg, and then when I converted it, just over a pound, about a pound and a half. So I said to the doctor, so hold on, at this stage, still just not even 2 pounds yet, and so it means that the baby's put on weight rapidly in the last 2 to 3 months, and that's just amazing. Again, the mystery of birth and the goodness of God in making all of this possible.
So I did tell you in private and how I appreciate you. So I'm going to make it public now, guys. Well, you have seen it. I appreciate this man. He has been very supportive. And he has taken over tonight's series. I wonder if. So, man, I really appreciate it. It's really good to have a partner that supports, that is there. I don't know how single mothers, really, 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 I don't know how you do it, but hats off to you for raising your children. Other single mothers, I cannot imagine how hard it is, because even having someone with you, it gets overwhelming at times. It does get overwhelming. So I really appreciate the support, especially when the pain hits and you can't move, or you can't get up, or you can't tend to the other child or other children. It's really good to have somebody, to step in and to do it. Somebody full-time, not part-time, we have to wait. But it's really good to have a full-time partner, around, who's there physically and in every way. So thanks, babe. I appreciate you. So
you're welcome. You're welcome. It's my pleasure.
Yes, I know. So what to pack in your hospital bag? What's the good thing about my hospital bag this time is that I work at a company that sells all the baby stuff. So it's just to grab and to go literally. So when I get those items, I'm going to be packing my bags on one of our episodes.
Alright.
And I'm going to show you all the things that you can get from my company, all the good stuff, the good things them for mommy and for baby. So when it's time to pack, probably next 2 weeks,
Soon.
I will have the items and the mommy and baby bag, and I'm gonna pack the stuff and share them with you. So when it's your time or your family time or friends time, you know what to get and where to get them.
Where to go.
Alright? So we'll see you another time.
See you soon. Take care. Remember to keep safe. Keep spreading love in our world. Our world needs love. Right? Peace out. God bless.